Good afternoon and welcome. I'm Celina Gorre, the CEO here at WomenHeart. We are a patient-centered organization that provides support, education, and advocacy for women living with and at risk of heart disease. We're very excited to be holding this webinar today to discuss the COVID-19 vaccine and what women with heart disease need to know. This is a topic that has not only dominated the news for months, well, really the past year, but I would venture to guess that nearly every adult has at some point in the last 6 months spent some time thinking about whether or not they will get the vaccine, and if they would, how and when. We know that about 35% of the US population has been fully vaccinated as of now, with millions more halfway there. We also know that many people have questions or concerns about the vaccine. We know from listening to women with heart disease that they have many questions, some of which are quite broad, like, can I trust the science and what I'm hearing about the vaccine on the news? Is the vaccine safe? What does it mean to be vaccinated? And how can I live my life safely after I get it? And then there are many questions that are specific to heart disease. Like, can I get the vaccine if I've had a heart transplant? What particular side effects should I worry about given that I have a heart condition? So today we're here to answer some of those questions and to maintain a dialogue about the COVID-19 vaccine. It's a critically important tool in our toolbox for fighting the pandemic, the coronavirus. And it's also important that everyone has the information they need to feel comfortable. We also want to make sure we're dispelling myths, and that we want to make sure we are also answering questions that you might have. But before we dive in, we'd like to ask you, we want to do a quick poll with you to see where you're at with the vaccine. And I'll ask that we put the poll up now. So that's the question, are you vaccinated? So please take a moment to answer. And we will see the results shortly. This is exciting, I'm curious. Where do I see the results? Let's see. I don't see where we find the results. We will share the results when we have them. So thanks for that, and thanks for providing your input. So now I'm really pleased. Oh, here they are. We've got the results. So, wow, this is amazing. I'm really surprised by this. 93% of you are fully vaccinated. Congratulations. We've got with the remaining 7% of you who have gotten your first shot. So you're halfway there. So congratulations. This is clearly a very aware group of participants today. So let's dive right in. I'm very pleased that we are joined today by Dr. Karol Watson. She's part of the WomenHeart Scientific Advisory Council and a professor of medicine and cardiology at the David Geffen School of Medicine at UCLA, which is my alma mater, so go Bruins. She's also the co-director of the UCLA program in preventive cardiology and the director of the UCLA Barbara Streisand's Women Heart Health program. Thank you so much, Dr. Watson, for being with us today. And after we hear from Dr. Watson, we're going to hear from two amazing WomenHeart champions, Adrienne Coleman and Maggie Teliska, who will share their experiences as women living with heart disease who've received the vaccine. So let's get started. I'm going to hand it over to Dr. Watson.
Thank you so much. And thank you so much for hosting this webinar. It's very important for all of us to think about these issues, especially as we try to navigate our way out of this pandemic. So we're going to talk about the COVID-19 vaccine and what women with heart disease need to know. I'm going to give you a little bit of background about why we're even talking about a vaccine. As all of you know, there are a number of important things we can do to prevent the spread of COVID-19. Wearing a mask, social distancing, that all helps you lower your risk. But these are not going to be enough to get us out of this pandemic. And we know that the vaccinations will be an important component to help keeping us all well from getting sick from COVID-19. We're so fortunate as a scientist. I can't tell you how excited I am about the science behind all this, and the fact that we have 3 highly efficacious vaccines available in the US is pretty amazing. They've been shown to be very safe. They've been shown to be very effective. So the combination of getting a number of people vaccinated, following all the CDC recommendations for how to protect yourself, your family, and others, the more people we get to do these things, the faster we can all get back to what we want to do, and that's resume life as we knew it. So vaccines prevent diseases. Some of them are annoying and sometimes deadly, like chickenpox. Other times they're annoying and often deadly, like COVID. And a vaccine helps your immune system produce antibodies, just like it would if it were naturally exposed to the disease. So this is what we all have to remember. The vaccine is helping your body evoke the immune response it needs to in order to combat COVID-19. So after getting vaccinated, you have protection from the disease to which you were just vaccinated, and you don't actually have to get sick first. That's what makes vaccines so powerful. As you know, I'm a big proponent of prevention. Vaccines are the most important preventive strategies we have for a number of different diseases. So currently there are 3 vaccines available in the US. They've all received emergency use authorization, or EUA, from the Food and Drug Administration. And the 3 vaccines are from Pfizer, Moderna, and Johnson & Johnson. They're all safe, and they're all highly effective against serious illness, hospitalization, and death. The Pfizer-Moderna vaccines require 2 doses, given about 3 to 4 weeks apart. You need to get both doses to be fully vaccinated, and then a couple of weeks after that, you really have been fully immune. The Johnson & Johnson vaccine is only 1 dose, and again, you have to wait about a week or so after to be fully immune. So I'm going to go into this really on a very top level basis, because I don't think I think this is an incredibly complicated, complex system that was employed via years and years and years of dedicated research. So I'm going to obviously skim through it and not do it full justice, but I just wanted to give you an idea of what do we mean about the viral vector vaccines or the mRNA vaccines. Well, there are 2 different types. The J&J vaccine is a viral vector vaccine. So viral vector, what does that mean? So whatever you want to enter a sort of a vaccine to enter the system, a viral vector is required to shuttle it in. So the J&J vaccine delivers a spike protein, and that's a protein that exists on the surface of SARS-CoV-2, the virus that causes COVID-19. That spike protein is the protein to which our immune system reacts. It kills the virus, gets it out of our system so we don't get ill. The J&J vaccine uses this viral vector. It's a shuttle to deliver this spike protein to the body. That's a harmless protein. It does not cause illness. But what it does is it teaches your own body to recognize and therefore attack SARS-CoV-2. The viral vector is harmless. It's been studied in hundreds and millions of thousands of years of patient use. It's very harmless. It's a totally different virus than the SARS-CoV-2 virus, and the SARS-CoV-2 virus is not administered at all in this vaccine. The Pfizer and Moderna vaccines use mRNA, messenger RNA. That is a naturally occurring protein that we make in our own bodies. I like to think of it like the body's own cookbook. So basically, our genetic code is what decides all the proteins we make in our body. But then your body has to understand, like, what do I make? How do I make it? And it uses mRNA to tell it how to do that. So the mRNA vaccines teach your body how to make that SARS-CoV-2 spike protein. So instead of administering it exogenously, you're teaching your body how to make it endogenously. Remember, that spike protein is harmless. It's just trying to teach your immune system what to attack so that the SARS-CoV-2 virus cannot get into your body and attack it. The good news about mRNA vaccines is that once they get into your system and they teach your body how to make that spike protein, they are rapidly degraded and completely removed from the body. They never stick around. So the actual SARS-CoV-2 virus is not administered. There's nothing that sticks around to change your DNA. Nothing at all interacts with your DNA. It's just teaching your body how to make this spike protein. All of these vaccines have been tested extensively, and they all offer strong protection against COVID-19. So they've all been shown to be safe. That is an absolute demand of the FDA. They've all been shown to lower hospitalization, lower the risk of death, lower the risk of severe illness. As I mentioned, the Pfizer and Moderna vaccines require 2 doses, 3 to 4 weeks apart. The Johnson & Johnson vaccine is 1 dose. And when you look at the efficacy against severe infection or death, it's virtually 100% for all of them. When you look at the efficacy against any infection, it's very high for Pfizer Moderna, and it's about 2/3 for Johnson & Johnson. You may say, 2/3, that's not enough. 2/3 efficacy against any infection at all is highly efficacious. And therefore, you're taking what could be a deadly disease and turning it into a non-life-threatening disease. And I have a little video to sort of explain how that works.
Say a vaccine is 67% effective. Does that mean you're protected 67% of the time and your chances of getting sick are 33%? Nope. With that vaccine, your chances of getting sick are actually much smaller. Here's why. A vaccine's efficacy number comes from a big trial with tens of thousands of volunteers. So imagine a trial as a stadium full of people and COVID as seagull poop. We'll give half the people umbrella hats. Like the vaccine, they offer protection. The other half gets something called a placebo, which doesn't do anything but helps make comparisons. In the vaccine trial, the placebo was salt water. Here, it's a sweatband. Both offer 0 protection. To calculate effectiveness, you compare who gets pooped on from each side. The number of people who got pooped on from both sides are represented here by brown dots. So if the vaccine is 67% effective, the numbers look like this. If it's 80% effective, the brown dots on the vaccine side are fewer, and at 95%, even fewer. And remember, this is in a stadium of tens of thousands of people. Plus, the people on the vaccine side who did get goop, it hit their shoes or their shirts. Meanwhile, on Team Placebo, some people got hit in the face. So the most serious effects are prevented by the umbrella hat, even if you do get hit by poop. So the trials tell us that the vaccines work well and prevent the most severe illness. That's something to cheer about.
So I know it's a little crude, but I thought that was a really good illustration of how these vaccines are protecting us. And even that 67% number is pretty darn good, and it really is effective at preventing severe illness. But I can tell you, all of these vaccines are highly effective and highly safe. They're safe and effective. They help build immunity against the SARS-CoV-2 virus. They've reduced the likelihood of getting COVID-19. And if you do get it, they lessen the severity, and they reduce the risk for hospitalization and death. So whatever vaccine you can get is the vaccine you should get. And the American Heart Association agrees as well. So this is an advisory that the American Heart Association released saying heart disease and stroke medical experts urge the public to get COVID-19 vaccinations to help us in the pandemic. And also because, as you know, certain people are more prone to getting COVID-19 and getting very sick from it. Those include people with pre-existing cardiac disease. So anyone with pre-existing heart disease, prior stroke, peripheral arterial disease, any vascular disease, heart, everything, they're at higher risk of developing COVID-19 and of getting very, very ill from COVID-19. So especially in these populations, we want to recommend vaccination. And I'm going to preface all of this by saying every single one of you needs to talk to your own practitioner and figure out what's right for you. But the general recommendations are that people with heart disease get the COVID-19 vaccine. Okay, but one of the things I hear from a lot of people is, oh my God, this was so fast. How could this possibly be safe? Well, fortunately, the FDA is around and the FDA is demanding that this is safe. No corners were cut. What helped us in this is that we already had a lot of helpful information about coronaviruses. That's the same class of viruses that cause the common cold and flu. And every year, you know, they create a flu vaccine. So we really kind of get how to make coronavirus vaccines. A lot of people were willing to participate in these trials because this was so important, and we are so grateful for all of these volunteers. So that helped us get the data necessary to prove safety and efficacy very fast. The government also was very helpful in putting a lot of money into this effort. So things that often take a lot of time and money dribbles out, they infused money up front so we could get these answers very full. And the manufacturing facilities were well aware of how important this was, so they were ready and able to just get going with the vaccines and distribute them as soon as the EUA was released. And remember, vaccines go through more testing than any other pharmaceutical. As I said, the FDA knows that all therapeutics that they approve have to be effective, but for vaccines, they also demand a level of rigor and safety that's unprecedented. So they have a lot of trials that start off with very small groups of people, then larger groups of people, and then more and more people. And they sometimes pick people with a specific comorbidity like hypertension or a certain race, and they keep giving it to many people until they get all the data they need to prove that it's safe and effective. So I know we've heard a lot about the pause of the J&J vaccine in particular, and I wanted to talk about that because that has gotten a lot of people a little spooked about all vaccines. Let me tell you what happened. So when a vaccine or any therapeutic receives emergency use authorization, the FDA says the balance of data says this is very safe and very effective, but we're going to be watching it very, very closely, and you're going to let us know if any signal of any adverse event at all shows up, and we're going to investigate. And that's what happened. So on April 13th, the FDA and the CDC paused the use of the J&J vaccine because 6 people developed a rare blood clot soon after getting the vaccine. That's 6 people out of millions and millions of people who received the vaccine. Scientists studied the data and tried to figure out were there any common features about who got it? Is there something we can see in the vaccine? They looked at it over and over, upside down, all different ways. And on April 23rd, they said, you know, we don't see it. This is something that we think is safe and still effective. So we once again want you to be able to get this vaccine because of the very large benefits outweigh any small risk of a blood clot. So they're going to continue to monitor this, and any side effects have been and will continue to be reported. But I want to remind people of this. The risk of blood clots with the J&J vaccine, 6 cases over almost 7 million administered vaccines, is 0.000014%. The risk of blood clots for an average young woman taking birth control pills is about 0.05%. The risk of smoking is about 0.18%. And as you know, SARS-CoV-2 infection is highly related to blood clots. So the risk of getting a blood clot if you happen to get COVID-19 is about 16.5%. So these are all devastating. We don't want anyone to get a blood clot, but we especially don't want a COVID-19 blood clot because the rates are so high and the outcomes so devastating. Okay, so I just want to go through some rapid fire questions that people have asked me. Can I get COVID-19 from the COVID-19 vaccines? A resounding no, 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 no. Vaccine does not contain any SARS-CoV-2 virus. That's the virus that causes COVID-19. So you cannot catch COVID-19 from the vaccine. Does the vaccine have any side effects? It does. But serious side effects are very rare. And most of the side effects are related to your immune system getting to work. So the side effects are normal and they show that your body is building a protection. And some of the things that you might feel are extreme fatigue, headache, pain in the arm where the injection was given, muscle or joint pain, chills, nausea, vomiting, fever. They're usually very short-lived. They're usually very easily treated. And they're usually a sign of your body reacting in the way it's supposed to a vaccine. What about vaccines? Are they safe for children? Well, you'll be interested to know that the FDA recently authorized the Pfizer vaccine under EUA for children down to the age of 12 and above, so they can receive the vaccine now. Moderna and Johnson & Johnson are still only authorized for people ages 18 and older, but the companies are looking at trials for younger individuals as well. Will the COVID-19 vaccine change my DNA? Absolutely not. The COVID-19 vaccines do not interact with your DNA, cannot change it in any way at all. And as I mentioned, these vaccines just teach our immune system how to fight a specific protein, the spike protein, which is on the surface of the SARS-CoV-2 virus. So basically, you're teaching your immune system how to fight a virus without having to first get sick from that virus. So the great news is that the COVID-19 vaccine does not interact with your DNA, your nucleus, anything at all. It's just teaching your body how to fight against SARS-CoV-2. All right, if I'm on a blood thinner, can I take the vaccination? Well, I will always preface this by saying, always check with your healthcare provider. But yes, in virtually every case, it's fine to take the vaccine if you're on a blood thinner. Are there any medications, like my heart medications, that might increase my risk of getting COVID-19? Again, always check with your healthcare provider, but there have been no studies that have confirmed that any medications increase the risk for COVID-19. Do I have to wear a mask if I'm fully vaccinated? Well, yes, and it depends on the situation. Because again, we're not yet at what we call herd immunity, where the virus cannot still transmit. So until more people are vaccinated, we still need to take some preventive measures. We need to continue wearing masks and avoiding, especially if we're indoors. But as you heard, the FDA loosened some of the requirements for wearing a mask when you're outdoors. But if you're in close contact with anyone else that you do not know their vaccination status for sure, wear your mask. You can visit people who are fully vaccinated, but you have to take precautions with people who are not yet vaccinated. If you have any illness or feel sick, stay at home. Make sure you isolate and test for COVID-19 if you have any concerns at all. But wash your hands, wear a mask when appropriate, keep your distance, and avoid large gatherings. And this is data from the CDC about what you can do if you're fully vaccinated. So the green circles are fully vaccinated, yellow circles are unvaccinated but at low risk for developing COVID, red are unvaccinated and at high risk, and the house is just a single household. If you have a single household where everyone's vaccinated and you want to go visit another household where everyone's vaccinated, no specific preventive measures are needed. If your household is fully vaccinated and you're going to go visit an unvaccinated household with low risk, you probably don't need preventive measures either. But if you're a fully vaccinated household who wants to visit a household where there are some unvaccinated people who are at high risk, definitely need to take preventive measures to protect them and yourself. And if you're a fully vaccinated household and you're going to visit multiple households, take preventive measures. And don't forget, these are the symptoms of COVID-19, mostly headache, congestion like a runny nose, cough or sore throat, shortness of breath or difficulty breathing, fatigue, muscle aches, body chills, loss of smell or taste. Symptoms can appear anywhere from 2 to 14 days after exposure. If you have any of those, stay home, stay away, get tested immediately. So that's all I wanted to share with you today. I hope it gave you some information about the vaccine and what to do to help protect yourself, your family, your community, and others. Thank you.
Thank you so much, Dr. Watson. I learned a lot in listening to your talk. I really appreciate it. And I know we've got some questions. So as they come in, I'm going to take note of that and then ask during the Q&A period towards the end. But I wanted to just start by asking questions specifically about the vaccine and the research that went into it. What can you tell us about the representation of women in the clinical trials, and in particular, women with chronic conditions like heart disease?
Yeah, so all the trials are, per the FDA, mandated to enroll a representative sample that looks like the general population. So women were expected to be about 50% of the trials. They don't always hit exactly that, but there are a large number of women in these trials. The trials enrolled, in general, a primary broad-based population, and I'm not aware of any trials that specifically enrolled, for instance, women with heart disease. But in those trials, there were people with heart disease. There were women with heart disease, and no signals of harm or decreased efficacy was seen in any of the trials.
Great. And what do we know about the vaccine's impact on reproductive health? It seems like there might be some short-term impact on a woman's menstrual cycle, but what can you tell us about that and any other kind of impact on fertility in general?
Yeah, so there should be none, and that there were no signals of any impact on fertility or menstrual health in the clinical trials. And I can tell you, I've heard some chatter on some of the blogs that this could be the case. A lot of things can affect a menstrual cycle, including anxiety, stress, and worry, including activated immune system. So again, I would urge everyone to talk to their healthcare provider, but to know and feel confident that there is no data suggesting any of these vaccines affect menstrual cycles or fertility.
Great. Thanks so much, Dr. Watson. Now, I want us to all hear from our champions, and we'll start with Adrienne. If you could just tell us the story and let us know if you've been vaccinated.
No problem. Thank you for inviting me to this, Celina. So as an introduction, my heart story began in 2010 when I survived a silent heart attack as a result of a 95% blockage in the left anterior descending. I received a stent, had little to no damage to the heart, and luckily I've made a full recovery. Yeah, thank you.
And so tell us about what your thoughts were going into, the vaccination process, and if you had any questions or concerns going in.
So when the news started trickling out that there was a vaccination, I had strong vaccine hesitancy. I am fully vaccinated, really happy to share that. I just was really, really nervous. I ended up talking with my provider, my primary care provider, who answered questions for me. The vaccination process was seamless, and the side effects were very, very short-lived and minimal. And they definitely outweighed the anxiety and stress that I had about contracting COVID.
Okay. And so now that you've been fully vaccinated, what are you looking forward to the most, and or what have you been able to experience thus far that you haven't been able to do in the last year?
Wow, this is the timing about this question is amazing. I got to visit with my mom in her home. She's fully vaccinated, but it had been a year. And I got to hug her and kiss her and just embrace her. And it was beyond the joy that I felt in my heart about knowing that we were both safe. I can't even describe the joy that I felt.
That's amazing. And so what message might you have for other women with heart disease about the vaccine and the vaccine process and getting it, and maybe addressing some other folks who might have some hesitancy?
So I'll start out by saying that the side effects are minimal compared to what it would be like if you contracted COVID.
Yeah.
If you believe and trust science, you should know that it is safe and effective. As a heart attack survivor who has a stent, I trust science. It saved my life long before COVID was on the scene. And so you can't pick and choose when to trust science, just straight across the board. I believe that it was well done, and I'm glad that I did it. And I encourage everyone to really think long and hard about what's best for them, but don't operate out of fear, operate out of what the scientific community is giving to us in other ways, right? I mean,
Sure.
If you're a heart attack survivor or you've got heart disease, you are relying on science to keep you safe and healthy. So.
Absolutely. Yeah. Great. Thank you so much, Adrienne. So let's move on to Maggie. Maggie, I'm going to ask you the same set of questions. If you can just start off with a story about your heart journey and also what your thoughts were around getting vaccinated.
Sure, and thank you again for having me on this. I'm really happy to be here. So Maggie, I live in North Boston with my husband and cat. I survived a heart attack in 2015 at the age of 42. It was significant, and unfortunately I did sustain some damage in my left ventricle. As a result, I do have a low ejection fraction, which means that my heart can't pump out the amount of oxygenated blood that it should be pumping out or potentially could. And I also have heart failure. I also, like Adrienne, I have 2 stents, and I have an ICD here, which is a cardioverter defibrillator, which functions just to get me out of a bad arrhythmia because my heart sometimes might not be strong enough to do that. And I'm also a WomenHeart Champion with Adrienne, class of 2020, and I co-lead the Massachusetts chapter here, and I know some of my support group is on this call today, so hi guys.
Hey.
I had no hesitation to get the vaccine. I think there are some things that Dr. Watson had mentioned, life as we know it, as someone in heart disease and heart failure, you're always trying to get back to life as you know it. So, the vaccine was part of that path, and prevention is key. I think she mentioned too. When you have a compromised organ, or especially your heart, you have to do whatever you can to prevent other things from happening because it isn't normal, and you might not heal or survive as someone with a normal heart could. So I've been vaccinated fully for about a month now.
Great. And you said that you didn't have any hesitancy, but did you have any questions that you may have needed to seek some answers for, and where did you turn to for those answers?
Sure. So my very first WomenHeart event after I graduated, I think we graduated in October, I had my cardiology team give a webinar on my Facebook group. I run a heart failure Facebook group, and the topic was COVID. This was in December, and Dr. Lewis and Dr. Kelly Hedgepath had put together at that point what they knew about COVID and its effect on the heart, and then a lot about how to prevent. At that time, we weren't really sure when and where the vaccine would be distributed, but at that point, in front of that, in that webinar, we were all asking questions of them. And obviously, you know, as Dr. Watson said, and everyone should always consult with their care team first. But, you know, obviously for me, especially, yes, get it. It can prevent future issues with a compromised heart.
Great. Great. And so now that you're fully vaccinated, what are you most looking forward to, or what have you done since the vaccine?
Well, I had my father out, which was nice because he was also fully vaccinated.
Wonderful.
Say I used a turnpike bathroom, which might have caught something else, but you know, I felt okay to go on a short day trip with my husband, and we did use a turnpike bathroom. You know, I'm looking forward to just resuming life, getting back to, you know, the new normal that I've had since I've had this heart ailment. And just not being afraid. You know, and again, anything that I can do to prevent any other issue for me, I'm going to do. And you know, this was one hurdle that I had to get over, and it's over with now, and so I can resume a life that, you know, I want to have and enjoy.
Maggie, that's such a great message. But I was thinking, is there any other message that you might give to other women with heart disease thinking about the vaccine?
You know, if you're hesitant, the best thing to do is have a conversation with either your cardiologist or your primary care physician.
Yeah.
They have the data, they have the knowledge, and like my cardiologist and PCP always say, the data shows. I would have the conversation with them and ask your questions, get out what you're concerned about, and make the decision. But again, prevention is key. We have enough that we go through, so it's you know, anything we can check off the list that we don't have to deal with later is a good thing for us.
That's a really great, I think, approach and attitude to sort of the construct around the vaccine is really important, and I really like the way you think about it. Now I'd like to invite back Adrienne and Dr. Watson and see if, you know, any of those issues that arose, you know, in either Adrienne's or Maggie's stories, you know, could maybe help other women who might be hesitant in, you know, in their own vaccination journey. You know, I realize that, you know, this group that is listening today is quite skewed. I mean, you know, 93% of you are fully vaccinated. That's incredible. But I'm sure that you also want to take messages back to folks that may not be vaccinated. So, you know, I guess my question, Dr. Watson, for you is, how do we help others in their own journey of getting to that, you know, that moment of getting the vaccine? Vaccine hesitancy, you know, is a real thing. We know that getting folks to talk to their healthcare providers, that's important. But is there anything else that you might suggest we can do to help others in, you know, in getting to that vaccine?
Yeah, so I think everyone obviously will have to make their own personal decision, but I think a lot of people are fully believing in science and want to get back to normal, but they're just worried, and I get that, and I get that. The most important thing I can do when I talk to people is get from them what their concerns are. And I can tell you what I hear most often is, it's just so fast. I don't know, like, I don't know what's in there. Like, what I'll wait and see. Like, people are not dead set against getting it, but they just kind of want to wait and see. And I would submit now, we have about 100 million Americans who've gotten at least one shot. Yeah. So we've had a lot of information, and there have not been, I mean, when you think about the most we can say about these vaccines after almost 100 million or 200 million shots is there were 6 blood clots. That is safer than Tylenol, than aspirin, than anything you get over the counter. It's honestly as safe as you can get. It's almost a medical miracle how we got these great, efficacious, and safe vaccines like this. We are so fortunate.
I completely agree with you, and I was nerding out along with you, Dr. Watson, when you said that, you know, this is like some, you know, this is for any science geeks out there, like, this is incredible. It's incredible, you know, it is. But I will admit, along with Adrienne, prior to the vaccine actually being rolled out, I was hesitant for the exact reason, Dr. Watson, that you said. this is fast. And a typical process, how long does a typical vaccine process go?
Years.
Years.
Many years.
Right. So it is amazing that we have gone through this with such speed. And yet when the vaccine was made available, I had zero hesitation, zero worry or concern.
And it does show what we could all do when we get together and put our heads together. We're a pretty industrious society. This was amazing.
Yeah, absolutely. I'm going to turn, well, let me ask first if Maggie or Adrienne, if you had any questions for Dr. Watson before I turn to our great Q&As that are coming in from the audience.
No, I don't have any questions.
Okay.
Dr. Watson,
questions has already been asked, so
yeah, your presentation was really, really informative. Thank you so much.
Very good.
Awesome. So I'm going to go to Sam's question that was up first. Will an additional booster shot be required after being vaccinated with Pfizer, Moderna, or J&J? I mean, what's involved in developing those boosters after taking into account the various variants constantly emerging?
Almost certainly a booster will be required. A lot of the information about SARS-CoV-2, we've extrapolated from what we know about other coronaviruses. How often do you need to get your flu shot? Every year. We know that the immunity you get from your flu shot wanes after about a year. We also know different variants come up each and every year, so they actually formulate a new flu vaccine every year. I envision a similar thing going on with COVID. We're going to have to keep ahead of the mutations and keep ahead with the science. And our immunity naturally wanes to coronaviruses. So I'm certain we will need boosters. We don't know when, but we will.
Right. So what I'm hearing you say is we should think about this vaccine to COVID-19 in the same way that we think about flu vaccine.
Well, kind of, because you go every year and get your flu vaccine. And I think I'm hoping that they will make it as seamless and widely available as they've made the vaccines thus far, because that's what we need.
So another question has come in, Dr. Watson, about, I'm just going to read it. It says, I'm hearing that a notable percentage of individuals are opting not to get the second mRNA shot due to concerns over side effects, believing the first shot is good enough. Can you speak to this and the impact that this may have on the potential to reach herd immunity?
That's a great question. So the data suggests, well, first of all, the clinical trials were done with 2 shots, either 3 weeks apart or 4 weeks apart. So that's what we know works. So all those numbers I showed you about 95%, 100% efficacy, that's only for people who got 2 shots. We do know, though, that from people who got the shot and then you check their antibody levels a couple of weeks out, it looks like they have a fair amount of antibody and maybe are 80% affected, or I'm sorry, protected. But 80% is not, I mean, when we can get to 100%, that's what we want to do. And here's the problem. The more SARS-CoV-2 is allowed to proliferate, the more variants will pop up. So partial immunity, incomplete immunity, lack of immunity at all just makes us all less safe. Getting the vaccine the way it was prescribed in the time period it was prescribed is what's going to keep us the safest.
Great. Yeah, that's a really great point. If you can, why not, right? If it's available, we should do what is available, and that's what our contribution can be in this fight. It's a side note, when I got my first shot, I was shockingly emotional. I didn't expect it at all, but I started crying and I was like, what is wrong with me? Where did this come from?
Sort of tongue in
and I
cheek,
think because
I joke that one of the side effects is extreme gratitude, because I was just grateful for science. I felt the same way, Celina. I felt weirdly emotional in a way I didn't expect to. Grateful for scientists and science and all the volunteers.
Yeah, it's really incredible. So Ellen has a question about, is there any info on the risks for children and adolescents on future effects or future effects on their DNA?
Yeah, there's zero effects on the DNA. It does not impact your DNA at all. So that we know.
Okay.
And again, that the FDA granted EUA for 12 and up for the Pfizer vaccine tells you they've done their extensive review of the literature and the data and the clinical trials that have shown safety and efficacy for this age group. So I think.
Do you anticipate it going younger than 12?
They're doing studies as well, but again, we have to see the data to know.
Yeah. And that's just interesting in the context of what we know about transmission among kids, right? And I just find that to be fascinating from a scientific standpoint as well, that we know it's
and it's just like the flu shot. You know, your pediatricians usually recommend your kids get a flu shot, so
right,
it may be the same.
Right. We've got another question from Amy. Were you influenced by your own providers to get the vaccine? That's for Maggie or for Adrienne?
I was 1,000% influenced by my primary care provider. And in fact, my cardiologist got her vaccine on Instagram Live. And she's an African-American woman. And seeing her taking that vaccine went a long way in helping me personally minimize my vaccine hesitancy. Shortly thereafter, I had a consultation with my PCP about another matter, and she brought it up in the same context of, you know, how is your blood pressure, or how are you feeling? And it was just very normalized. That also helped a lot. And then she answered questions that I had. And so they were tremendously influential in eliminating my vaccine hesitancy, as well as being super excited about getting it versus being terrified.
That's great. Maggie?
Yeah, I knew I wanted it, and I think my cardiologist and PCP really confirmed the fact that I should get it. So it was more of a, okay, I'm ready to get it now. But again, we had that really great informational session in December that brought everything to light and really educated myself on, you know, what this was doing and the vaccine that was coming along. So
I'm going to add my own question in here for Dr. Watson. Dr. Watson, presumably you got it quite early on in the, you know, in the grand scheme of things. Yeah.
In December.
How did that change with healthcare providers getting the vaccine? How did that change the mood, the mental health of healthcare providers? I'm just envisioning what this,
it changed everything. I can tell you from March through December of 2020, I was virtually scared for my life every time I went into the hospital. I think all of us were, but this is our job. This is what we do. And but I can't tell you the relief that came over everyone's face, mood, etc. once we were able to get protection.
Yeah, that I can only imagine.
Could I add something to that as well?
Sure,
as a patient, it was difficult last year not being able to see our physicians and our care team. And while virtual was there, it wasn't the same. And, you know, I wanted someone to listen to my heart because it usually has something to say. But it was a relief too to know that my care team was being vaccinated, because if I needed to see them, I could physically go in and see them.
Yeah, great. Now the questions are rolling in. My goodness. They don't want us to end. So I'm going to take a few more. Karen wants to know, what about returning to work? What precautions might need to be considered in that context? And I guess part of the answer, Karen, is depends on the work environment, right? So, but I'll turn it over to Dr. Watson.
Yeah, and similar to the guidelines the CDC has released for households, think of your workplace as a household. You can't know if every single person in there is vaccinated, I don't think. Maybe you can. But again, you treat it like this is a non-vaccinated or presumably higher risk population, and you still mask. We're still socially distanced. We have to be.
Yeah. What if you had COVID, then had the first shot and had a terrible reaction? Now due to the second shot, so now somebody is expressing that they're quite afraid to get that second shot because they had such a horrible reaction on the first.
Yeah, so think about what vaccines are doing and think about what infections are doing. When you get an infection, your body says, oh my gosh, there's something trying to kill me, sends out all the cavalry, makes antibodies and T cells, everything to say, attack this foreigner, get rid of it, and remember him. So then you have that memory. Same thing happens when you get a vaccine, except the way vaccines are engineered, they're engineered to say, attack him, remember him for a lot longer. So the immune memory to a vaccine is longer, typically, than immune memory to a natural infection. So even if you've had it, people are like, I don't need to get the vaccine, I had. No, of course you do. You want the more robust and longer lasting immune response that the vaccine will give you. And the fact that you had COVID and then had a severe reaction after your first shot makes total sense. Because remember, after your first infection, your body said, wait a minute, who's that guy? We don't know him. Figure out how to fight him and remember him. And so then you got the vaccine. It's like, oh, there's that guy again. We remember him. We're going to react right away. And that's why you had a robust immune response the second time. And that's why people often have more symptoms after the second shot, because they're like, oh, look, it's Joe again. Get him. But this is all your body reacting exactly like it's supposed to. And I know those symptoms can be quite uncomfortable, but they are showing that your immune system is really good, really revved up and really working.
Well, and
get the second shot. You have to get the second shot.
Get the second shot, absolutely. But I want to ask a follow-up question about side effects, because I've heard the opposite now. Like the worse your side effects, the better your immune system is working. Like the better the vaccine is working on you. So that I feel like that's the other side of the coin.
So unfortunately, all those side effects I showed you are signs that your immune system, your B cells are working. They're making antibodies. They're protecting you. There are many people who have a robust immune reaction and don't have side effects. But if you do have side effects, it's pretty clear you're having a robust immune reaction. So think of it as the blessings of a strong immune system.
Yeah. And Maggie and Adrienne, you shared that you had some side effects, but they didn't last long, or can you tell us about that?
Yeah, mine weren't that bad. I had a fever for both of them, and that meant I was building immunity and was working.
Yeah.
And just fatigue, which I'm always tired, but I had a little bit extra fatigue.
I had no side effects after the first vaccination. The second vaccination, I had soreness at the injection site. I got my vaccination at 3:00 in the morning because they do 24/7 here in Arizona. So I came home, I slept for a little while and got up and I thought, oh, I'm great. And then sat down to drink my coffee and said, oh no, I'm really not. I'm going back to bed. That was the last thing I remember until the next day. And then the next day I was fine.
Okay, great. We've got two last questions. One, I think you've already maybe addressed, Dr. Watson. One is the vaccine infused thrombocytopenia I'm hearing about related to the heavy menstrual bleeding? These side effects seem serious.
So that there have been reports of an immune-related thrombocytopenia, which means a very low platelet count, but also clotting, and they're often related ironically. So the platelets are the little partial cell types that make you clot. And if it gets really, really low, it typically leads to excess bleeding. But oftentimes in this weird immune reaction, it can be also related to blood clotting. So what I've heard chatter in blogs as well about heavier menstrual periods, that's not the same thing. The immune-related thrombocytopenia is life-threatening bleeds, not just heavy periods, but really, really low platelet counts and dangerous bleeds. It's very different. So, again, and I'm not discounting anyone's experience, but heavy menstrual period protection from COVID, I think protection from COVID is a very worthwhile thing. And I don't, most of the people I've heard complaining of heavier menstrual periods, it's not life-threatening. It is the sort of heavy flow, not dying from COVID.
Yeah. Yeah. And then the last question, I'm not sure what this is, so you might have to explain it to me. I've signed up for V-Safe and wonder how we will get the results of any longer term issues. Does anyone know what V-Safe is? I'm guessing this is like signing up to follow somebody sort of track their symptoms or track the effectiveness of the.
Yeah, I don't know
vaccine?
what V-Safe is especially, but I got it, like I told you, prevention is really hard. And so the FDA is so smart. They're preventing from people from getting things that they may or may not get in the future. You're going to absolutely make sure what you're giving them is safe, 1000%. So that there are many different surveillance procedures. Do you remember when you got your vaccine? They took down the lot number, where you were, what the date was. They can track each and every person to each individual molecule very extensively. So they are really following carefully the side effects. So I think V-Safe sounds like it's probably some other alternative way of tracking side effects.
So, yeah, so I'm just, so it says it's from the CDC. It texts weekly. It texts me weekly to track my reactions to the vaccine. So I think that is so just checking to see.
CDC another way, but again, it's gathering more data because this is a. Think about this, you guys. We never even saw this virus. We had no idea it existed before 2019. We're 15, 16 months later, and look at how much we're learning. So getting more and more information is important.
I often say that this is really the first time that the public has been so engaged in the real time, like science, like the messiness of science and the real time kind of, you know, normally when we hear about something, by the time we hear about it in public, it's that research has been going on for years. And, you know, any disagreements or, you know, any kind of issues have been worked out long before it hits CNN or the nightly news. And so we're seeing this in real time, which is just fascinating.
And how well the system has worked and is working, we all should be so grateful and relieved.
Yeah, absolutely. Yeah, that was the last thing I wanted to point out, that my process was incredibly smooth, and everyone just felt like they were so pleased, you know, from the person checking me in to the person giving me the shot to the person watching me for 15 minutes. Across the board, that system was impeccable. And so again, for those who have yet to do it, you know, of course, you know, make sure you have all the information you need. But the process itself, they made it as easy as possible. As easy as possible.
Completely agree.
So we are, gosh, it's how the time has flown. We're 2 minutes to 5. I want to, first of all, thank our sponsors who, you know, were really helpful in providing WomenHeart the opportunity to provide this information to you all today. I want to thank Dr. Watson for, I think, a great presentation, and also a presentation that's going to stick in my mind for a long time, because it spoke so directly, I think, to the things that I've been thinking about in the context of this vaccine and vaccination process. And lastly, but certainly not least, I'd love to thank Maggie and Adrienne for sharing their stories. I'm always amazed by the courage that our champions have in sharing a little bit of themselves with not just with us, but with all of you out there. Thank you for spending some time with us this afternoon. Thanks to the audience and the participants. And thanks all for getting your vaccine. That's helps all of us. So with that, have a good rest of your day, and we'll see you again soon. Bye-bye.